Hello everyone, welcome back to CMME Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. Mosquito-borne diseases are very common in developing countries like India and also other countries in Indian subcontinent like Pakistan, Bangladesh, Sri Lanka, etc. It is also very common in African countries, and lot of mosquito-borne diseases are reported from Africa. So in today's video, we shall learn how we can prevent mosquito-borne diseases. There are so many species of mosquito all over the world, but in India, the important species are Aedes mosquito, Anopheles mosquito and Culex mosquito. Aedes mosquito, which is specially known for transmission of dengue, the species are Aedes aegypti and Aedes albopictus. On the other hand, the Anopheles mosquito associated with malaria transmission can be Anopheles culiciphasis, fluviatilis, minimus, philippinensis, stephensii, sandicus and leucosphaerus. Culex mosquito associated with filaria transmission are Culex fatigans. So these are the images. You can focus on this one. This is the Aedes mosquito. It has black body and especially the limbs are black with white dots or stripes. So that is why this is also known as tiger mosquito. Culex mosquito on the other hand is a little bit elongated shaped. Now let us look at some of the diseases transmitted by different mosquito species in India. Anopheles is known to transmit malaria in our country. It can also transmit filaria, but filaria is not transmitted in India by Anopheles mosquito. Rather, it is Culex mosquito that transmit the Bancroftian filariasis, where the causative agent is Wuchereria bancrofti. It can also transmit Japanese encephalitis, West Nile fever and viral arthritis, which can be epidemic of viral arthritis or which can be polyarthritic in nature. Aedes mosquito on the other hand can transmit yellow fever, but it does not transmit yellow fever in India. In India, we do not have any case of yellow fever. But remember, since we have so many Aedes mosquito in our country, that means we already have the vector in abundance. Now, yellow fever is a disease of international importance. That means people who often travel from one country to another, it is important that they take the yellow fever vaccine before leaving for the endemic country. So, if by any means we import few cases of yellow fever in our country, as there are so many Aedes mosquito which are the vector for yellow fever, the vector or the mosquito can transmit the disease to other people very rapidly. So that is why we take yellow fever very seriously. But yellow fever so far is not transmitted in India because we do not have any case so far. Other than that, the other diseases which are transmitted by Aedes are dengue. It can be classical dengue fever, it can be dengue hemorrhagic fever, and it can be complicated to dengue shock syndrome. We know that. Chikungunya fever, chikungunya hemorrhagic fever, Rift Valley fever are also transmitted by Aedes mosquito. Again, here also, just like Anopheles, Aedes can also transmit filaria, but it does not occur in India. Mansonoids mosquito can transmit filariasis or filaria, but in this case, the causative agent is Brugia malai and Wuchereria bancrofti. These are the two agents for filariasis. Wuchereria bancrofti is transmitted by Culex and Brugia malai is transmitted by Mansonoids. Sometimes chikungunya can also be transmitted by Mansonoids, but in our country, chikungunya is more commonly transmitted by Aedes mosquito. Whenever we are trying to control the mosquito-borne disease or trying to prevent the mosquito-borne disease, we must try to control the mosquito, which acts as the vector for all the diseases that we learned in the previous table. Or if we cannot control the mosquito population, what we can do is we can try to minimize the vector human contact. That means the interaction between the human population and the mosquito population. Now, controlling mosquito should be done at its immature stage as well as in the adult stage. So, immature stage means the larval stage. Whenever the mosquito is in larval stage, we shall try to control the mosquito population, or we can also try to control the mosquito population at its adult stage. Again, the approach that is taken for controlling the mosquito population to reduce the or to control the mosquito-borne diseases is known as integrated vector management. Often we ask our students why it is called integrated vector management. In the next part of the videos, we shall learn that there are multiple approaches that we can take to control the mosquito population or to minimize the interaction between the mosquito and human. Since there is no single best option, it is ideal that we integrate all these methods or all these different approaches together to control the mosquito population and to reduce the mosquito-human interaction. So, since all these methods are integrated together, that is why it is known as integrated vector management or IVM. Integrated vector management comprise larva control, adult mosquito control and reducing human vector contact. So, this first to the larval control and adult mosquito control is basically controlling the vector itself at its larval stage as well as its adult stage. And also we can try to reduce the human mosquito interaction. So, larval control includes source reduction, chemical control and biological control. Adult mosquito control includes indoor residual spray, also known as IRS, space spraying, insecticide treated nets or ITNs. To reduce the human vector contact, we can use ITNs. Along with that, improved housing and personal protection are important. We shall discuss all these methods in details next. First is source reduction for larval control. We have few images here, but the theme is quite common. We can see there are accumulation or collection of water. These are the discarded plastic buckets or different utensils. This is discarded rubber tube, coconut shell. This is fountain that we can find in the garden, in the park, where birds sit, drink water or take a bath during the summer season. These are also known as potential mosquito breeding places. So, we have to find out or we have to identify the potential mosquito breeding places in or around our houses in the community, and we have to discard the water. That means we have to eliminate the potential mosquito breeding places. If we could collect a sample from all this stagnant water, we could see that there are larvae of mosquito. So, these are the larvae as you can see. Generally, Anopheles mosquito breed in clear water, Culex mosquito breed in dirty water and Aedes mosquito breed in artificially collected water. So, this is about source reduction, where we have to identify and eliminate the potential mosquito breeding places. Next one is chemical control using larvicidal agents. So, these are the images of larva, mosquito larva. We can use mineral oils like kerosene, diesel or even certain larvicidal oils. We know the property of oil, it floats on the water. So, since it is lighter than water, when we apply the oils on the body surface or the water body, it floats and it cuts off the oxygen supply to the water body. And because of that, due to lack of oxygen, the mosquito larva would die. Now, one major disadvantage of this method is due to lack of oxygen, even the flora and fauna of the water body would also suffer. That means the plants or even the fishes in the water body would die. So this is mineral oils. Then we have Paris green. This is an emerald green amorphous crystalline powder. The chemical name is copper acetoarsenite. Now this is stomach poison. So when we apply Paris green in the water body, it is ingested by the larva, and after being ingested, it acts as a poison and it kills the mosquito larva. So this is Paris green. The next one is we have certain synthetic insecticide like organophosphorus compounds, for example Fenthian, chlorpyrifos and abate. Abate is very popular, so we can also apply all these insecticides, these synthetic insecticides in the water body, and that will kill the mosquito larva. So this is chemical control. Next is biological control by larvivorous fishes. So we have Gambusia affinis, also commonly known as the mosquito fish, and then we have Levistar reticulatus, commonly known as guppy fish. So if we use, or rather put all these fishes in the water body where mosquito can breed, these fishes would eat the mosquito larva because they are larvivorous fishes, and the mosquito population will decrease. Then we have indoor residual spray for adult mosquito control. As the name suggests, something is sprayed inside the house, that is why indoor. Before and more usually after biting, most of the mosquito rest on wall, ceiling or in other dark areas inside the house. You would see, if you look around you in your house, there may be mosquito sitting on the walls, on the ceiling, or even in the dark corners of the room. This mosquito, even after taking the blood meal, may remain inside the house. So if all the surfaces inside the house are sprayed with residual insecticide, it can kill the adult mosquito. Residual means when these insecticides are sprayed, its action would remain for a long period of time. The chemicals or insecticides rather, which are used for indoor residual spraying are DDT, malathion and some synthetic pyrethroids. Now this WP means wettable powder, because all these insecticides come in powder form. They have to be dissolved in water so that they can be sprayed. On the right hand side you can see this is the person, a qualified person or trained person who is doing the IRS on the wall of the inside of the house. Anyway, there are certain places where the mosquitoes are resistant to DDT. In that case, malathion is used for IRS. If we are doing the IRS with DDT, then 2 rounds are to be done, whereas in case of malathion, 3 rounds of spray are needed. This is a very commonly asked MCQ question. So indoor residual spray is for indoor, that means inside the house, whereas space spraying is for outside, that means in the environment outside the house. The insecticidal formulation is sprayed into the atmosphere in the form of a mist or fog to kill insects including adult mosquitoes. The different chemicals or insecticides which are used for space spraying are pyrethrum extracts and residual insecticides like malathion or phenytothionein, etc. And this is known as ultra low volume space spraying. As you can see, again this is another person who has a fogging gun, and this is the nozzle, and this is the fog like thing coming out of this nozzle or this apparatus, and he is doing the space spraying outside the house. Insecticide treated nets can be used for controlling the adult mosquito population as well as to minimize the interaction between the mosquito and the human population. So mosquito nets treated with insecticides provide better and effective protection by keeping away mosquitoes as well as killing them. So when we treat a mosquito net with insecticides, it can kill the mosquito. Also, the mosquito net itself acts as a physical barrier in between the mosquito population and also the human population. So, whoever is sleeping inside the mosquito net, he will be protected against the mosquito bite. Insecticide treated bed nets can be either conventional ITNs or long lasting impregnated nets. The different insecticides which are used for treating these mosquito nets are pyrethrin, permethrin and deltamethrin. Now, what is the difference between conventional ITN and long lasting impregnated nets? Let us learn in the next slide. Conventional ITNs must be treated once or twice a year depending on the duration of transmission cycle or transmission season. It means we take the regular mosquito net that we commonly use or regularly use in our house and we treat it with certain insecticides once or twice a year depending on the duration of the transmission season, which means in a year for how many months the mosquitoes transmit the disease. So depending on that duration, we have to treat the regularly used mosquito nets once or twice every year. So this is conventional ITN. On the other hand, LLINs or long lasting insecticide or impregnated nets are mosquito nets whose fibers have been impregnated with insecticide by a special technique so that the insecticidal effect is maintained throughout 20 washes or through about 20 washes or as long as net can withstand daily usage, that is 3 to 5 years. That means during the time of production, that means in the factory, when these mosquito nets are being produced or manufactured, there is a special technique where these fibers of the mosquito nets are treated with or impregnated with certain insecticides, and because of that the effect of these insecticides last for a long period of time. So as long as 20 washes or maybe even up to 3 to 5 years. So as you can see, the action of LLIN lasts for a very long period of time as compared to conventional ITN. So it is always better to go for LLIN. Other protective measures to prevent mosquito bites include window screening, where we use screening or mesh in the window so that mosquitoes cannot enter inside the house and bite people, or wearing full sleeve clothing, which can be little bit uncomfortable during the summer season, and mosquito repellents. We have chemical repellent as well as the mosquito coils, etc. But especially the mosquito coils, they are very much bad for the people, especially having respiratory diseases. So if there is any person suffering from bronchial asthma or COPD, these repellents can be quite irritant to their respiratory tract and they can have respiratory distress. So that is why these are generally not advised to everyone. Next is health education, which is obviously most important because people must understand why we are doing what we are doing. They should be aware that mosquito bite can cause many diseases. So what are the diseases caused by mosquito? What are the clinical features? When they should visit the nearest hospital for medical advices? How they can prevent the mosquito-borne diseases? So all these things they should know. For that, we have different method to impart the health education. We have information education, communication or IIC materials. So here are some examples. These are the IIC materials for dengue. Here we have mentioned that any artificial collection of water can lead to mosquito breeding and can lead to dengue. Here the health education is being given by miking. So we can use social media, television, radio, posters, banners, etc. everything for the benefit of the common people. Some other IIC material. So this is for malaria. So all this precaution and also this statutory warnings. This is for filaria. We can see this is an image of elephantiasis of leg. This is hydrocele. People are being advised to sleep under the mosquito net to keep the environmental clean and also to take the drugs for mass drug administration, which is DEC is given along with albendazole. So people should take the drugs, etc. So this is about the health education. People must know the importance of mosquito-borne diseases, how they can prevent them, etc. Last but not the least, the community participation. So after being sensitized, that means when they understand the importance of all these efforts, people in the community can be motivated and they can take part together in identifying all the potential breeding places and eliminating them in or around their houses or in the community. So this is not an individual effort, but all the people in the community, all of us have to work together so that we can prevent the mosquito-borne diseases, which takes away so many lives every year from all these countries. With this, we conclude today's session. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends. We also have our Facebook page. The link is given in the description. Take care and we shall see you in your next video.